Chapter 4, Health Information Systems, attempts to answer 4 questions. What are hospital information systems? What are institutional health information systems? What are the challenges for health information systems? And what are electronic health records? The book gives a good definition of health information systems as the social technical subsystem of a hospital, which comprises of all processing as well as the associated human and technical factors in their respective information processing roles. Basically, what the book is trying to tell you here is that you need to look at the scope of a hospital information system beyond just the actual technology components. It includes the people factor as well, working cooperatively with the technology to develop a complete system working within the hospital environment. Obviously, there's subsystems, as we went over in previous chapters. You have a system, and then a system has subsystems that basically work interrelated together, or relationally together, inside of the parent system to produce, in this case they describe as being used by or produced by actors. An actor can be either human or a technology. To move towards its goal, to provide sufficiently or is to sufficiently enable the adequate execution of hospital functions, ultimately for patient care, taking into account a good health information system is going to take into account the economics of the hospital management as well as legal and other requirements. So you can't just put a health information system out there that doesn't comply with legal requirements, managing the security of information, managing the exchange of information with information technology protocols or IEEE protocols or ISO standards, things like this. So HIS has to consider all of the different areas that reside within the hospital, subsystems you could describe them, or generally speaking, clinical and administrative areas. The health information system has to support the laboratory just as much as it has to support the accounting office or hospital management. So both considerations and areas within the medical center divided between clinical administrative have to be considered with the health information system itself. With the health information system comes the complexity of, or the opportunity to exchange information between two healthcare institutions. The book defines a group of 2 or more legally separated healthcare institutions that temporarily or voluntarily join together to achieve a common purpose defined as a healthcare network. A common purpose might be the exchange of information between 2 healthcare systems or healthcare institutions. So one hospital A owned by corporation A, or hospital B owned by corporation B, or both are owned by the same corporation. The 2 want to exchange healthcare data or healthcare information between the providers in order to provide some type of a consistent healthcare between or with the patient between facilities. So there's lots of reasons why the medical centers or healthcare institutions would want to do this to create a healthcare network. Well, the information system of a healthcare network is called a trans-institutional healthcare information system. So this becomes a very complex scenario, but also a growing, modern, very, let's say that a lot of institutions are moving in this direction, very common. An example might be, let's say there's that the medical center doesn't have its own pharmacy, but they want to exchange information with a local pharmaceutical institution or like a local pharmaceutical clinic. The healthcare institution would create a healthcare network agreement between the 2 of them. They have a common purpose, which is to prescribe medications for their patients. The pharmaceutical clinic would then receive those prescriptions from the physicians in the medical center, and that then becomes a trans-institutional healthcare information system if those systems exchange information between the two. Which then brings forth in this chapter the discussion on electronic healthcare records. Is the key component or a large key component of a healthcare information system. The patient record itself can be defined in general as composed of all the data and documents that are generated or received during the care of the patient at a healthcare institution. So this could be anything from written notes by providers to prescriptions to lab reports generated by laboratory systems. And this specific definition is not limited to an electronic means. It can be paper-based means as well, so both interchangeably. So a patient record really is all of this information, this data as the patient receives care in a common location. So when you talk about an electronic healthcare record, really what you're saying is that all this data, this record, is stored in an electronic document carrier or carrier system. So an example I pulled off of Wikipedia. If you go there and you look up electronic health record and query it, you'll see different examples. This is a common one. This is used in the U.S. Department of Veterans Affairs. They did a screenshot apparently for Wikipedia. This shows an example of an electronic health record system where the patient has all of the information available and at the fingertips, if you will, of the provider here. In this case, you can see a sample patient, some screenshot they probably made of an example patient, fake, I'm sure, where you see the x-rays, scopes. They show trends in a healthcare analysis of some sort of data that's sitting there. So this gives you sort of a snapshot of different pieces of a healthcare record and how those different, the entire healthcare record system is broken up into subsystems. With that comes a tremendous amount of challenges for healthcare information systems. Notably so, user acceptance is huge for newly implemented healthcare information systems, especially when you're putting it into a hospital setting where the physicians have been doing nothing but paper-based notes. So in many cases, providers have difficulty changing their practices of documenting patient care, putting it into an electronic format. They may have issues with the GUI, the user interface. They may have issues with the way that data flows or it's entered, or the way that you actually interact with the keyboard or the mouse. There's lots of things that can come up where users just do not want to accept it. In many cases, it becomes an issue where the hospital administration would have to mandate the use of it. So user acceptance is a huge challenge for the implementation, for successful implementation. There's also the issue of data redundancy. What happens is you have all of these subsystems that inside of the healthcare information system, for instance, the lab department and, say, the pharmacy department. In some cases, depending on how the healthcare information system was put together or how it's designed, some data could end up being redundant. And jumping forward, you see that maintaining referential integrity and transcription, those sort of lay hand in hand as well. What happens is, let's say that in the laboratory module that they reference the patient in this specific way because that module was developed separately by a different team, but it all integrates into the healthcare system. And then say the pharmacy package or the pharmacy software module, it also references patient information that is the same, and it enters patient information that is redundant of the lab package. So sometimes you suddenly have worries, or not necessarily worries, but you have this issue of making sure that the system maintains the integrity or reference towards the patient with all these different modules and does it with integrity. And then there's also a lot of costs involved that end up happening when you're dealing with healthcare information systems. These costs can be extraordinarily high considering on how much it takes in order to maintain data, to store the data, to make sure its integrity is there. And then always a concern of privacy and security. This is number one priority for many organizations, especially those that have to comply with standards such as HIPAA and things like this. So privacy and security of the system is critical. It is a necessary requirement. So you're dealing with patient health information, private information that needs to stay within the institution and be accessible only to those who legally have the right to view and interact with that information. Terminology becomes a challenge, especially when you're talking about the actual health information system itself. The education going along with that, a lot of times, dealing with the data from the standpoint of observing what the system is generating as providers are making transactions with it, dealing with that terminology, understanding it, sometimes can be a challenge, especially from the administrative side of standpoint. Maybe some would interpret the visit of the patient to be one thing, and another would interpret it in another way based on the terminology that the system generates. Stability is also a huge requirement and challenge for health information systems, because once these systems are instituted or implemented within healthcare institutions, the stability of the uptime, it's mission critical now when healthcare and the safety of a patient is involved. You want to make sure the availability of the system is always up, backup systems, redundant systems. So the stability of a health information system can be critical to the safety and the care of the patient. And then, of course, as mentioned previously, the trans-institutional management becomes a huge challenge as the health information system from this one institution begins to become part of a healthcare network with another institution. And the management between those two institutions becomes a huge technical and logistical challenge as well. So with that, Chapter 4 has a homework assignment on the blackboard. If you go on there, you'll see HW4, Chapter 4-Health Information Systems. This has 8 essay questions. There are some PDF files that are required to answer some of the questions, and those can be downloaded from the blackboard also.